I'd like to take some time to talk to you a little bit about my practice and how it's different than what other surgeons do. First off, I'm a surgeon, but I'm also a scientist. My background is an MD and a PhD. I've done specialized training in research focused on tissue engineering and bioengineering, where we look at not just the body, but also the cells and the important key regulators and metabolites that affect cell survival and that change basically the way that you heal on the inside. I like to utilize some of the technology and concepts that I've learned in that training to improve the quality of results in my practice. I combine a knowledge of surgery, anatomy, and results with a deeper understanding of the technology and the science behind the healing process and aging in order to improve the quality of my patients' outcomes. So how do I do this? Well, for instance, with regards to my approach to pain, I utilize an understanding of the scientific knowledge about pain, the theories behind what pain is, what causes it, and how to prevent it. And I couple that with what I do on my daily practice to get it such that we can reduce the amount of pain that patients feel before, during, and after the surgical procedure. Similarly, with technology, I like to utilize modern technology in my surgical approaches in order to use new devices and instruments to improve the quality of outcomes, for instance, in body contouring. I utilize techniques and technologies that help to improve the quality of fat survival and fat grafting, and other techniques that improve the quality of the natural result in facelift and in abdominoplasty. I couple an understanding of the anatomy of what we're doing with the scientific knowledge about those procedures and the research that's been done in the past so that I know that I'm giving you the best quality result that we can possibly give at this point in time. The other way that training helps to inform my process is I utilize the scientific method in my own practice. So I practice what I preach. I publish papers on the outcomes of my patients in full transparency to show you what the results look like. I publish on new and different techniques and strategies that I use, and that helps to show you that it's published in a peer-reviewed journal, that it's been reviewed by other doctors, that this isn't an experiment, this is really a state-of-the-art, well-vetted scientific approach to give you the best result. And I've done that many times. I've published over 127 articles in different journals on plastic surgery regarding techniques, interventions, and really looking back at the quality of those results over time to figure out what the best possible interventions are for patients. I've also given talks at national meetings, over 453 abstracts, where we've gotten the ability to go up on stage, and I go up and help to share the science, share the research, share the projects with other surgeons and other doctors around the world. So I couple my understanding of the surgical procedure with that scientific approach, with state-of-the-art techniques, and with a promise to my patients, that I'm going to continue to improve what I'm doing over time, to improve not just your care, but the care in general that we provide in the specialty of plastic surgery. And that's how I do things a little differently. Now, one other thing that I do that's different is my approach to patient care. I spend a lot of time in the initial consult with patients going over the education that you need for your procedure and for your body. And I really go to an effort to show you not just what I'm going to do and how it's different, but what your expectation should be for the healing process, for the immediate process after surgery, but even years out. I also spend extra time with patients after surgery. It's not just surgery and see you later. I come the night of if you're staying in an aftercare facility. I see you the next day to make sure that you're safe and you're comfortable. And you really can't get away from me for the first 3 months after surgery. You're coming back at 1 week, 4 to 6 weeks, 3 months, and then again 6 months and 1 year. Even patients that fly in from outside of the country or outside of the state are in close contact with me via virtual consultation, and they do have to come back to be seen at that 3-month time point. Why is that? Well, because how am I going to know if my results are good unless I see my patients? How am I going to know what their post-op period is like unless I'm a part of that journey? This has really been a critical part in my early practice to identifying ways to continue to improve what I'm doing. And that's why it's going to be a part of what I do in the future, to know that the results are good, to know that the pain is being controlled, and to know that your issues and concerns are being addressed in my office with me. I think that these are critical ways that I differentiate myself and my practice. And they're also the ways that I know when I go home at night that I can sleep well, knowing that I'm providing the best possible care to my patients on a very consistent and regular basis. And these are the reasons why I think you should come and have a consultation with me in my practice.